As a provider in the SNF, you manage complex conditions daily, from wound healing to post-operative recovery. What is one of the most powerful tools in your arsenal to improve outcomes for all of these? Tobacco cessation counseling. This is your guide to mastering this high-impact intervention. These are time-based codes for face-to-face counseling. 99406 is for an intermediate session lasting 3 to 10 minutes. For an intensive session lasting more than 10 minutes, you'll use 99407. Remember, the clock starts the moment you begin the counseling, and any session under 3 minutes is considered part of your standard EM visit.
Let's bring the 5 A's framework to life. Ask every patient about tobacco use. Advise them to quit with a personalized message. As your provider, I need to tell you that quitting smoking is the most important thing you can do to help your leg wound heal properly. Assess their readiness. On a scale of 1 to 10, how ready are you to quit? Assist by discussing barriers and offering medication. And arrange a specific follow-up. Let's talk about this again at our next visit in 2 weeks. What if the patient isn't ready to quit? This is not a failure, it's an opportunity for motivational interviewing. Use the 5 R's to guide the conversation. Discuss the relevance of quitting to them personally. Explore their perceived risks of continuing and the rewards of stopping. Help them identify roadblocks to quitting. Finally, commit to repetition. You will bring it up again. This respectful approach builds trust and plants the seeds for future change.
Now, for a critical billing nuance, you can absolutely bill 99406 or 99407 on the same day as another EM visit, like a subsequent visit for CHF. To do this correctly and avoid denials, you must append modifier 25 to the E/M code. This tells the payer that the E/M visit was a significant, separately identifiable service from the counseling. Your claim must be linked to a tobacco dependence diagnosis code, like F17.210, and be mindful of frequency limits, which are payer-specific. Medicare, for example, allows 8 sessions per year. Finally, your documentation must be rock solid. A clear time attestation is mandatory.
Let's look at a denial-proof note for an intensive session with a patient who isn't ready to quit. Notice how it includes the time, the framework used, the patient's stage of readiness, and the diagnosis link. This level of detail justifies the service and paints a clear picture of the skilled work performed. To recap, use the 5 A's for patients ready to quit and the 5 R's for those who aren't. When billing with another E/M, use modifier 25 on the E/M code. Always link to a dependence diagnosis and document your time clearly. These conversations are challenging, but they are the bedrock of preventative medicine. By consistently and compassionately offering this support, you are changing lives.